Can everyone see my screen? Perfect. Okay.
Yes.
Welcome, everybody. We're going to get started in just a moment. We're just going to give everyone a few more moments to join. All right, everybody, it's 12 o'clock. So thank you for joining us today. I am going to turn it over to ASH Executive Director, Laurent Hubert.
Thank you. Welcome everyone to this webinar on tobacco industry interference in policymaking, and also the launch of the latest US Tobacco Industry Interference Index, which is basically the de facto global monitoring on tobacco industry interference on health policy around the globe and in the United States. And probably most of you are quite familiar, and you're probably hearing a lot about COP and the COP26 for the Framework Convention on Climate Change. And most of the world is following this very important process. And at ASH, over the last 20 years, we've been very involved in the Global Tobacco Treaty, the Framework Convention on Tobacco Control. And this treaty recognizes the negative impact of industry interference. And for these reasons, countries around the world have included an article in this treaty which basically states that countries must not allow industry to interfere in health policies. And this is Article 5.3, and you'll hear a lot about it today as you hear from the various speakers. And just the same as with the Framework Convention on Climate Change, the Framework Convention on Tobacco Control has a governing body as negotiations that take place pretty much every 2 years. And those are called the Conference of the Parties. And the next one will be actually just next week virtually. But when those every time those treaties negotiations begin, and it's every single time, country after country, when they make their initial speech at the beginning of this treaty, they always say that the major barrier to implementing tobacco control policies at country level is tobacco industry interference. So it's something that we see country after country, and even recently the UN Development Program has stated the same thing. They've noted the same thing. And even this current, the most recent Lancet publication has an article on implementation of non-communicable disease policies from 2015 to 2020, and a geopolitical analysis of 194 countries. So what they did in this with this study is they looked at the impact of democracy, governance, corruption, industry interference on progress towards non-communicable diseases, so cancer, cardiovascular diseases, lung diseases, and diabetes. And basically, the conclusion was that democracy, and this is the most current article in The Lancet, the latest publication of The Lancet, that democracy is positively associated with policy implementation, but only in countries with low corporate permeation. So basically, they mean that only in countries with low corporate influence on government decisions. And they're basically calling on countries that saying that urgent action is needed to boost implementation of policies targeting corporate vectors of NCDs, like tobacco industry, and to support countries facing high corporate permeation. So basically, high influence from the industry. And the tobacco industry is really the poster child or the poster case example of corporate permeation. And unfortunately, it's all over the world, and not in the United States, as well as in other countries around the world. So today you will hear from three great speakers who will cover first the global perspective and address why it's important for governments to not allow the industry to interfere in health policies. Second speaker will share UAs and state local examples of tobacco industry interference and tobacco control countermeasures. And the third one will walk us through this year's finding and recommendation in the most recent release of the tobacco industry interference index in the United States. So before I introduce the speaker, just very quick housekeeping issues. You can start addressing questions to the speakers by using the Q&A tool, which is at the bottom of the screen, and use that to ask questions, and you can address them to a specific speaker. So I will introduce the first speaker, who's Laura Salgado. She's the Global Campaign Coordinator for the Global Center for Good Governance and Tobacco Control, and has years of experience working in global tobacco control. And she will introduce us to the Global Tobacco Industry Interference Index and give us a global perspective and importance of this implementing Article 5.3 of the Framework Convention of Tobacco Control. Laura, the floor is yours.
Thank you, Laurent. Thank you for the invitation to be part of the launch of this important index. As we can see in the presentation, in the first slide, as Laurent mentioned already, the next one, please. Laurent mentioned the importance that the Article 5.3 has, and it is considered as a backbone of the treaty, since the success of the rest of the treaty measures depends on effective implementation of the Article 5.3. The next one, please. So we prepared a shadow report, the Global Tobacco Industry Interference Index on the implementation on the Article 5.3 to review the government efforts to identify what exactly government has done or not done. We did the first one in 2019 that covered 33 countries. The second one was last year covering 57 countries, and this year we covered 80 countries. Also this year, 2 regions has their own regional report, that is Africa and Europe, and Latin America has the second version of this report. Next one, please. As we can see here in this map, the civil society groups survey 80 countries from the 6 regions across the globe. The way the index works is that the lower score is the lower level of the tobacco interference. And as we can see, no country was spared of the tobacco industry interference across the world. Even during the pandemic, although smoking is no risk factor for COVID-19, it was a business as usual for the industry. Next one, please. As we can see here, for the index, we select 7 indicators taken from the Article 5.3 guidelines and looks at where the industry is allowed to participate in the policy development, how the interaction is conducted, and how the governments are protecting their efforts. Also looks how the government receive or endorse the tobacco-related CSR activities, what kind of benefits they have given to the tobacco industry, and the transparency of the tobacco industry actions. We review the information and rank country according to the findings. As we see here in this graphic, the top 5 countries that are in yellow and in light green, New Zealand, UK, France, and Uganda, those are the countries showing the least interference. And in the other side, in the color maroon or red, are the countries showing most interference. Here, Dominican Republic, Switzerland, and Japan also have the weakest tobacco control measures. The next one, please. Some of the main findings at global level. So we have some good news. While the tobacco industry interferes with policy in many governments, a few made progress protecting their policies, and they are Botswana, who published tobacco control law limiting the interaction with the tobacco industry, prohibit partnership, and giving incentives to the industry. The Indian ministers, the health minister adopted a code of conduct in July, restricting the collaboration of officials with the tobacco industry. And Cambodia, Ministry of Education, Youth, and Sport banned all forms of partnership with the tobacco industry among education facilities. So while these governments were putting in place good measures, the industry was able to interfere, and some of the legislation were delayed in other countries like Guatemala, South Africa, Tanzania, and Zambia. Next one, please. The CSR activities during the pandemic, many governments were short of public health resources. Some like Botswana, Spain, Chile, and India step up efforts to protect the health policy, but others accept the tobacco industry donations or lobbying. Increasing the tobacco taxes, for example, were delayed, and the industry was able to open new markets for electronic products in some of the countries. The next one, please. The tobacco industry behavior during the COVID-19 wasn't just business as usual. This research suggests that it's been far worse in terms of the scale and impact. In the middle of the pandemic, health should be the primary consideration in all the policy decisions, but it was often sidelined in favor of the tobacco industry interests. Some governments like Bangladesh, Jordan, Sudan, Malaysia, and Kenya deemed cigarettes as essential items to be sold during the lockdown. Next one, please. We also identify that no parties faced high level of interference, like Argentina, Dominican Republic have remained no parties to the FCTC, faced the high levels of the tobacco industry interference that has undermined the tobacco control. These governments encourage tobacco business by providing incentives, sustaining industry-friendly legislation, and promoting the tobacco industry internationally. Next one, please. And some other countries, the governments forced to agreement or alliance with the tobacco industry. For example, in Colombia and Dominican Republic, they secure collaboration with the governments to do training programs and accepting donations to enforce activities, especially for the illicit trade. area. Next one, please. The advantage of doing the Tobacco Industry Interference Index on a regular basis is that it enabled one to trace trends of any progress in implementation or deterioration. Between 2010 and 2001, 18 countries improved their score, while 33 countries deteriorated. Spain, Chile, and Sudan made the most improvement, while Peru, Uganda, Solomon, and also US, their status review that they deteriorate in the score. The next one, please. So the question is, how can the government protect themselves? The answer is in the Article 5.3 guidelines. It provides specific measures for the government. How can they implement and protect their policies? Some of them is to ensure there is transparency, whether they have to meet with the tobacco industry. We should be limited only to when it's restricted or relating to that regulation. Public officials can be firewall themselves through a code of conduct or rules engagement with the tobacco industry. The industry should be made to declare its marketing expenses and lobby activities. And the ministers of health must increase awareness about the 5.3 to no health sectors. For this, it is important a multi-sectoral approach and involve the participation of the whole of government area and the civil society participation. Next one, please. We can find, you can visit this website to get more information about the results of the different, the global index and the different index at country level. Next one, and thank you. Up to you, Lauren.
Thank you, Laura. And it was interesting how you point out that the direct correlation between industry interference and the more industry interference, the worse are the tobacco control policies at local level. So now we'll move on from this very global perspective to a very localized, more local one. And so LaTrisha Vetaw, who's the Director of Health Policy and Advocacy at NorthPoint's Health and Wellness Center in North Minneapolis, she will provide a local perspective on real-time action at the state and local level and how to counter advocate around the area of tobacco. LaTrisha, the floor is yours.
Thank you so very much. Thank you for this opportunity. So yeah, I just want to share some work and experiences that we had on the local level here in Minneapolis, Minnesota in 2017. I was actually in DC at the Women's March and got a text message saying that the Reverend Al Sharpton and some other folks, some activists here in the United States were in Minneapolis at local Black churches asking churches to host a rally. This is January and it's Minneapolis, so it's freezing cold outside. They wanted to have a rally and a town hall meeting at some of the Black churches here in Minneapolis. And it was just a little surprising, like I said, that they would want an outdoor rally in January. And I had, over the years, I've built a strong coalition, and in particular in faith-based organizations. So I had a strong coalition of faith leaders who I had been working with for about 10 years at that time. And a couple of them reached out to me and said they had been having meetings with Reverend Sharpton and they didn't understand, what the meeting was about. When I got back home, I realized that Reverend Al Sharpton, former state representative Kendrick Meek, I think he was from Florida, and two African-American men who were former law enforcement officers had come to Minneapolis, and they wanted to warn faith leaders about a menthol policy that we were working on in Minneapolis, restricting the sale of menthol tobacco. So the pastor who agreed to have them at his church for the town hall, I had a long relationship with. So he said that if, Reverend Sharpton was going to be able to speak in the town hall, so would I, and I could bring some of my colleagues who worked in public health along with me to the town hall. Fortunately, at that time, we were hosting a statewide tobacco conference. So all the who's who in the public health and the world of tobacco prevention was in the Twin Cities. So of course, I had a great group of folks who could come with me to this town hall, and some of our partners from California were in town and others locally. This town hall was specific to Black men, and they spoke to the criminalization of menthol and how Black men would be thrown to the ground if they were caught by police with menthol cigarettes and maybe harmed. I mean, it was really egregious. There was just so many bad things kind of thrown out there by this group of Black men who were here, supposedly to warn our community about a menthol ban or restricting the sale of menthol tobacco at the time is what we were discussing. And so I came over, I was at the tobacco convention over in St. Paul. After the first breakout session, myself and maybe 20 others came over. I had called on some of our champions at the Capitol who had been helping on tobacco control. 2 African-American legislators who were helping came over as well. And we met at the church, and Reverend Sharpton was there. We had heard that he had a great speech in other cities about criminalizing tobacco and Black men. So I was extremely prepared for him and ready to take on big tobacco. I found out right away that most people in the room who were attending the town hall, and it was a pretty packed meeting. They had a good turnout. Most people in the room didn't understand that Reverend Sharpton had come on Reynolds America's dime. When he got up and spoke, he referred to Reynolds like it was REI, the sporting goods store. He didn't really say, Reynolds America. He just used the acronym. And so they had provided this really nice lunch with chicken and all this stuff. And so, everyone's eating and he's up talking and he's just kind of downplaying it. I'm here for Reynolds, REI. He kind of, the letters all kind of went together. And so, he did his spiel. It wasn't as dynamic as I thought it would have been. He kind of just like talked softly about things. And then these 2 officers, one of them actually cried and said that this was his opportunity to reverse what he had done in the community to Black and brown people. There were tears coming out of his eyes and saying like, this was him helping us by correcting this big mistake we were going to make around tobacco. And I knew it was all baloney, but the people in the room like really felt like they were there to help. And so it was my turn to speak. Finally, the pastor gave me equal amount of time to speak as they did. And so the first thing I said when I got up, everyone's eating, enjoying the lunch. I let everyone in the room know that they were eating off of Reynolds America's dime, that the tobacco industry had bought the very chicken that they were putting in their mouth in that second. And if you looked around the room, you just saw all the food just drop out of everyone's hands in the room. Everyone was like, oh, what? And so that was my first order of business, was to let them know that he was a paid consultant. He wasn't there to educate them on anything. They were all paid consultants, and they were coming in to scare us. And, the real danger here is tobacco. The fact that, over 80% of African Americans smoke Newport. And here they are having someone who we trust in our community to be a voice, to be a positive voice here, selling us this messaging that is killing us. And so once I got my message across, it changed the room, the mood, everything shifted a lot. People were listening. There were a lot more questions about targeting. There was an opportunity for me to speak with the group about how we had been targeted for decades by big tobacco. And yeah, I mean, like Reverend Sharpton just stopped. He didn't push the issue anymore. Our policy passed here in Minneapolis and in St. Paul and in Duluth, Minnesota. So we had 3 huge policies passed. I attribute us being prepared for them when they got here to coalition building. We had a large group of folks who have been working on this. Had I not had that relationship with the faith community, maybe we wouldn't have had a seat at a table to really dig into what is happening in our communities with tobacco industry executives and the targeting of communities of color and young people. Everyone heard the messaging loud and clear because they've seen the publications, they've seen, certain products in certain stores. I would say it was successful because the policies passed. What I heard in other cities was that this group was a lot more boisterous, and we didn't see that. They really did. I mean, we won that battle. We won that battle here in Minneapolis when they showed up. That's it for me.
Thank you, LaTrisha. And that's very interesting what you point out. And if you had not been there, even to be able to monitor that process and then expose the fact that Sharpton actually had received money from the tobacco industry, that whole group may not have realized that, and it may have changed things on the ground. So that's quite interesting, and it really highlights that need to expose it, to monitor this, and to intervene, because the industry is not acting in a transparent manner. So our next speaker will actually address some of that. Nichelle Gray, who's a program coordinator at ASH. She'll provide an overview of the Tobacco Industry Interference Index in the United States, which is then a way of tracking this process. So Nichelle, the floor is yours.
Thank you, Laurent, and thank you to the 2 previous speakers, for your great presentations. And thank you everyone for joining us today for the 3rd annual U.S. Tobacco Industry Interference Index. So before I get into some of the findings and key takeaways, I just wanted to take a moment to acknowledge some of the limitations that we have in the US report. So for one, the COVID-19 pandemic affected in-person tobacco control advocacy. So the information that was available from state and local advocates was much less than previous years and previous reports, specifically for indicators 2 and 8, which were directly inhibited by the virtual environment that we were in last year. Then we also have the scope of US domestic policy making. As we all know, tobacco control policy is governed at the federal, state, and local level, which provides a lot of entry points for the tobacco industry. So it was really beyond the scope of this report to undertake every jurisdiction. So this data should really be seen more broadly than as a comprehensive tally. And then finally, the US has signed but not ratified the WHO FCTC, which previous speakers have mentioned and Laurent has mentioned. So many of the Article 5.3 prohibited activities are actually constitutionally protected in the US. But despite these limitations, we can and should neutralize and expose tobacco industry interference. So next, I'll get into the report and this year's score. To your left, you'll see the cover of this year's Tobacco Industry Interference Index. The data obtained in this year's report was compiled between January 1st, 2020 and December 31st, 2020. The US total score for this year's report was 76 out of 100. And again, the higher the score, the higher the level of tobacco industry interference. Just want to note that the US actually started out with a raw data score of 72. So as you go through indicators and you tally up the numbers, you'll notice in number 72 was the total. But this was actually adjusted to 76 to reflect that the Stop Global Index applies a penalty rating to countries that aren't party to the WHO FCTC. So you can review the report. I believe it's page 17 to get some more information on how these scores are calculated. So how did the US measure up? Laura covered this a little bit, but the US was actually one of the 15 worst countries in terms of industry interference. And our global rank was 68 out of 80. So again, this shows a continued need to address tobacco industry interference across the nation. So now I'm going to get into some of the indicator findings and the key highlights from the report. Laura did touch on these a little bit, but I'll kind of cover what each indicator really means and then give you some examples of what was pulled out from last year. So the first indicator that we cover is policy participation. And that includes things like the government accepting support or offers of assistance from the tobacco industry. It also includes the government accepting legislation drafted by the industry and allowing tobacco industry to sit in on committees or advisory boards that set public health policy. Next, you'll see CSR, corporate social responsibility. This one is pretty straightforward. It's the government endorsing or supporting partnerships or participation in CSR organized by the tobacco industry. And here we have some examples from the report that included Governor Ralph Northam of Virginia, who asked tobacco companies to supply respirator masks. Then Altria also committed $1 million in COVID relief in Richmond, Virginia, and in regions where their products are manufactured. And then there were also some vaping manufacturers and retailers who donated bottles of hand sanitizer to police departments and fire departments. So next we have indicator 3, and this is benefits to the industry. Here we're talking about the government accommodating requests from the industry to delay tobacco control laws. We're also talking about giving privileges or incentives or exemptions to the tobacco industry. And we all know that the FDA's flavor ban exempted menthol flavors. It also exempted disposable vaping products, as well as the new IQOS heated tobacco sticks and Velo oral pouches. And then we have forms of unnecessary interaction, which includes government officials meeting with or fostering relationships with the industry, attending social functions and events sponsored by the industry, and accepting offers of assistance from the industry for enforcement. We have transparency, which includes disclosure of government meetings with the tobacco industry and specific rules of disclosure for those types of meetings. This wasn't the worst indicator for the US, but it can still use some improvement, which is why we have recently launched the ASH US Tobacco Lobbyists and Lobbying Firm Registration Tracker. This tracker focuses on publicly available state-level registrations in all 50 states and DC. The tracker is available on the ASH website, and we'll be sending a link around to the tracker so that you can all utilize that new tool. We also launched this in our webinar last week, and we'll send around a link so that you can watch that launch. So finally, we'll move on to the last two indicators, 6 and 7. These include a lot of items. For 6, we're talking about the government accepting contributions from the industry, campaign contributions and things like that. Government officials or their family members that work for the industry. For 7, we're talking about prevention. So we're talking about, public officials having a code of conduct when they deal with the industry directly, and also, raising awareness about the FCTC and the Article 5.3 guidelines. So we'll move on now to some of the recommendations that you'll find in the report. And it's important, for advocates and legislators to, look back on these, especially when you're embarking on addressing tobacco industry interference in public policy. So our first recommendation is to raise awareness of the WHO FCTC and its provisions, in particular with Article 5.3. There's relevance for all 50 states, despite the fact that we have not yet ratified the treaty. Then we must strengthen and standardize revolving door prohibitions. So lobbying is constitutionally protected. However, implementing longer periods between public officials leaving office and starting lobbying could lessen interference. Third, closing the loophole in executive branch ethics guidelines. There's currently no restriction on former tobacco industry reps serving as federal appointees. So closing this loophole could serve to prevent conflicts of interest. And then we have preventing conflicts of interest. Specifically here, we talk about with the US FDA approval process. The tobacco industry, as we know, historically manipulates the science in their favor. So the US FDA has used tobacco research when approving new drugs as tobacco products that contain nicotine. So then adopting an official code of conduct for government officials. I think LaTrisha would agree, and most public officials would agree, that public office is a public trust, and the principal objective of each public official is the welfare of the people. Then we talk about educating lawmakers and industry interference. Advocates can inform lawmakers of tobacco industry interference through fact sheets, by sharing this report, by sharing the global index, by leveraging media, and by utilizing tools like the ASH Lobbyist Tracker. And our final recommendation is to mandate philanthropic donation disclosures. The US doesn't mandate the reporting of philanthropic activities by companies, which allows the tobacco industry to hide certain actions, such as contributions to political action funds. So those are some of the strong recommendations that we have in the report. But before I wrap up, I just want to say that, everyone can take action. You can start with reading this report and sharing this report with your colleagues and partners, as well as the global report that shows how the US stacks up against other countries. And we also encourage you to continue to share your stories, like the story that LaTrisha shared. These are powerful stories that highlight the prevalence of tobacco industry interference in policymaking. And we'll actually be conducting research for the 2022 index. So we really rely on those stories to really give a full picture of what's going on. So with that, I will turn it back over to Laurent, but thank you all so much for joining us today.
Thank you, Nichelle. And so we're going to move on to the Q&A as part of this webinar. Again, feel free to direct them to a specific speaker, and use please the Q&A tool at the bottom of the screen. So the first question is going to go to you, Nichelle. And so you mentioned the tracker from that was launched last week. And then there is this, obviously, the Tobacco Industry Interference Index. So what would be your call to action to our audience on how can they use then those two tools to expose industry interference and to use that at the local level? How can they use those tools to make change at the local level?
Absolutely. I mean, one of the things that we talk about is, utilizing media. If you have the tools and the capability to really use your communications tools, an easy thing would be to share this on your social media platforms, share the index, and share the new lobbyist tracker tool. And then something else that can be done to kind of, highlight this and also spread it widely would be to write letters to the editor talking about these topics, op-eds, blogs, different ways that you can really leverage media platforms to kind of get the message out there and talk about your own personal stories in dealing with the industry and relating, these tools and this information back to what you've had to deal with. So the more we get this out and the more we highlight it, the better we can expose what's continuing to go on.
Thank you. So my next question will go to you, LaTrisha, and it ties to this. So first, I want to again congratulate you for, I understand, your recent election win. You're an upcoming politician. So in this role as a politician, how do you see the role you can take in exposing that corporate interference and basically in some cases manipulation of the local population? So and trying to manipulate politicians and so on and so forth. So you're in a very unique role and with your experience. So how do you see this moving forward, and how do you want to, using the role that you have and your expertise and having seen that?
Absolutely. I'm super excited. I'm glad you asked that question because I'm excited about the possibilities. I would hope that my colleagues on the council and other electeds will respect that I have been on the other side of this and have firsthand experience, not only with policy making, but also advocates. I'm that advocate. I'm the person. I'm kind of known in this town for my advocacy work around tobacco control. I expect that people that I work with now will reach out to me later and ask me to push policies. And I plan to continue using my voice as an elected official. I plan to continue using my voice for the health of folks who look like me and young people in this community throughout this country. It's a big deal that you have electeds who stand on the side of health. And I plan wholeheartedly to be that person and to push whomever I need to use my voice for sure.
It's wonderful to hear that. Wonderful to hear that. The next question will go to Laura. And so it's a question from Amos Hausner, who from Israel. And he's basically saying, should the next COP starting next week call upon countries to appoint a special authority, or at least a governmental authorized person to make sure that Article 5.3 and the guidelines they're under are fully implemented by the respective country. And he says, that goes on to say, this is indeed because it is by mistake taken for granted that the FCT is the business of ministries of health, while actually falls within the liability of many governmental offices and agencies in each country. I think it's true. It reminds us that tobacco control and implementation of the responsibility to address the tobacco epidemic, it's a whole of government responsibility. It cannot be the health ministry alone. We know we're not going to be able to kind of treat ourselves of that problem. We really have to set up a number of policies, and part of it is that industry interference. So what is your thought on, obviously we have a very difficult COP. It's going to be, because it's virtual, it's going to be just limited, but there is the 5.3 knowledge hub. So maybe you can explain to the audience how that works. I mean, so there's the treaty has an article to address industry interference, and then there's a knowledge hub which has that function that Amos Hausner is talking about. So could you describe how that works?
Yeah, well, we provide that technical support, and one of the recommendations of the guidelines says that we need to raise awareness about the tobacco industry interference, and not only at the health level, but also in the different sectors. All the government sectors should know about the intentions behind the good behavior of the tobacco industry. And also it is important to involve the civil society, the media, and all the different sectors of the society. We should come together to work and to strengthen the different actions. So we have information, we have all the scientific information behind explain how the tobacco industry works. We can see here in the index, and the same behavior that they have here is similar to the other regions. So as we understand how the industry works, our measures can be, or the tobacco controls measures can be implemented according to the industry behavior.
And I think one of the problems we have,
important.
obviously, with the FCTC and its implementation is the inadequate resources at country level for implementing the treaty, and when the industry has so much money. I mean, just whatever they spend in marketing or litigation dwarfs at times the resources that a lot of governments have.
Yeah, sorry, that's very important also to monitor the industry and to expose this kind of conduct.
Yeah, absolutely. So, and this is where I think this is a key role also for civil society, and that's why it's so important that everyone uses that tool, and the tools, the industry index at country level. Then I see, so there's a question from Michael Scott for LaTrisha. So as you mentioned, big tobacco and sharpton in France promote negative unintended consequences resulting from the menthol restrictions. We know the reality, but can you speak of what happened in St. Paul, Minnesota after the menthol restriction? So yeah, so what happened on the ground? How did things look like after the menthol ban went into effect?
It's looking better. You know, we have less access. What we did see though was shops had started to, in Minneapolis, we started to see like shops put up these clear 4 walls inside of corner stores and call them tobacco shops. Because the restriction was to the sale of those products to adult-only tobacco shops. I'm gonna move a little bit because I'm in the sun and I see you can't see. So yeah, we saw that happen. We have seen less access though. The number of stores that sold menthol and flavored tobacco in the Twin Cities and Duluth area dropped dramatically. So in Minneapolis, we went from over 200 stores that sold those products to, I believe, like 30 or something like that, stores with those products. But we did see, you know, these walls going up around the city inside stores where they called tobacco shops, where they called them tobacco shops. And then we saw stores have a new entrance on the, you know, the same store would have an entrance on a different side of the building, and that would be the tobacco shop. But it would be the same corner store that people got the products with. And we've worked through that stuff with the Minneapolis City Council in particular. But yeah, we saw that we had restrictions on where shops could be, the amount of shops in both cities. And so those things helped out as well.
And so it sounds like basically loopholes was unfortunately what was used to try to circumvent a little bit things.
Right. That's usually the industry's, like when we're working hard on something, they're usually trying to figure out how they can counter that. So like we're all excited about restricting the sale, and they're figuring out how to, whatever loophole they can figure out, whatever policy we haven't thought about or restriction. And so we knew something was going to come. Again, this work in Minnesota in particular is strong coalition work. And so we're always ready. We're always paying attention to what's happening. So like, you know, we again went back to those councils and did the work around restricting.
And what would you tell to Al Sharpton now in the context of, as an answer to, look what happened, did it have an impact on arrests of young African American males, for example? Did it have an impact?
Absolutely. I haven't heard of any stories like that at all in the Twin Cities, but earlier the question you asked, I think as an elected official, it's my job to expose people like Al Sharpton, right? Like he came here during the time after George Floyd was murdered. He comes to Minneapolis. He came to Minneapolis with George Floyd's with Eric Garner's mother. and he goes on this tour and talks about criminalization. He was the Black man who was killed in New York with loose cigarettes. And so his mom goes on tour with, Eric Garner's mother goes on tour with Al Sharpton and talks about criminalization. And, you know, I mean, it's so icky that he even like has her with him and talking about it in that way, because we know it's not true. And so, yeah, I think as an elected, it's really important for me to use my voice to let people know that Reverend Sharpton needs to be transparent and talk about where he gets his money from. And, you know, like really tell us, those leaders who have taken money from tobacco industry, we need to expose them and really push them to be transparent about where they're getting this money from and why they push this particular agenda.
This is very interesting. Just last week, I believe we had a representative from Common Cause. And one of the statements she said, which I thought was very powerful, is transparency matters. There's a direct correlation when there's a transparent process, when it's divulged where the money comes from that supports politicians or different processes, versus when it's not known. So it really does matter. And in this case, knowing that Al Sharpton is getting money from the industry does matter, because he would have clearly a different rhetoric if he wasn't receiving that money and was looking at the evidence. As you point out, after the menthol ban, there was no increase in arrests or anything like that. So,
and people would see him differently if he showed up to Minneapolis and said, "I'm here on Big Tobacco's dime, and I want to talk to you about this." The reception wouldn't have been so great. It's a respect from him because his name is Reverend Al Sharpton. So other reverends and pastors and, you know, clergy and faith organizations receive him as that, as a reverend and as, you know, a messenger of truth. But like I said, transparency is key here. And we just need to keep exposing folks who are not being transparent.
The next question, so I'll address it to you, Nichelle and Laura, to both of you, and I'd like to get both of your views on that. So where does US stand? Can you expand more a little bit where the US stands on industry interference, and what should be done about the United States particularly? Is there high levels of interference compared to other countries? It sounded like from your presentation, Laura, you did point out the US as a non-party that still has a fairly high level of industry interference. So I'd like to get both of your views on where the US stands right now and how much policymaking is impacted in the US as comparatively speaking to other countries.
Sure, Laura. Oh, did you want
to
go?
Go ahead. No, okay. Go ahead.
Yeah, actually, I mean, I did highlight in my presentation, you know, the global index monitored 80 countries this year, and we're 68 out of those 80 countries, which puts us at one of the 15 worst countries in terms of industry interference. And again, because we are measuring ourselves against those Article 5.3 guidelines, you know, we do have a very high level, you know, because there are a lot of things that we do in this country that are constitutionally protected. So lobbying and different measures that the industry takes to interfere with public policy making is prevalent more in this country than it is in others. And plus we have, as I mentioned, the three levels that they have entry points. So there's the federal, the state, and the local. Federally, we all know that the FDA's Tobacco Advisory Board contains, you know, tobacco industry representatives that represent the interest of the industry. They don't have voting rights, but there has to be some influence there. So it is very prevalent. There is a lot that needs to be done to improve this. And one of the main ways that we can do that is through more transparency about what's going on behind closed doors, as well as, you know, really divulging all of these conflicts of interest. But I'll pass it off to Laura.
Yes, Laura, go ahead.
Yeah, no, just to add what Nichelle said, I think that raise awareness is important things because most of the time it's the ministers of health or the health sector area who knows about the tobacco implications, but also it affects the economics, the environments, and of different sectors. During the pandemic, we have seen how the impact that tobacco has in our lives. So to raise awareness around this issue, to involve other sectors, government and society working together, that will help to strengthen the measure that we have. Ideally, we should ratify the FCTC, but if it is not, at least we can implement the key measures that the convention has, and we can use. And the guidelines, we have the Article 5.3 guidelines, 7 case recommendation that we can easily apply in the country in order to protect the policies that we already have.
Absolutely. The United States has every reason to want to protect its citizens in the same way other citizens of the world are protected. It's the same. That would be the same as saying if there's like with COVID, we would have said, oh, other countries will get vaccinated, but will not vaccinate the United States, even though that treatment exists. With the treaty, even without ratifying it, all the measures could be applied to the United States. And it's really saddening that, one of the most powerful countries in the world is among the 15 worst when it comes to industry interference. And when you see it, that just the launching of this Lancet article really stating that corporate permeability, basically industry interference in policy, health policy making is one of the biggest factors, one of the biggest obstacles. So it's something that really needs to be addressed. It's really a shame to have the United States so low in the totem pole. So I'm conscious of time. So we have about 6 minutes left. So I would like just to hear your last parting words from the three of you in this context. And so LaTrisha, do you want to get started? What are your last word of before the end of the webinar? What are your last thoughts? What you want to leave us with?
My last thoughts are just keep up the fight. There's always work for us to do. The tobacco industry has way more money and resources than we do on the side of public health. So keep up the fight. Always broaden your network. We need more people in this fight with us. Thank you for having me.
Thank you. Laura, why don't you go next?
Yeah, I invite to visit at our website. We have enough information that can help to implement the best measures for the tobacco control implementation, and we can strengthen the work.
And I really encourage American, US-based tobacco control advocates to use those global governance mechanisms and demand that they are used locally. There's no reason why American citizens should not deserve the same level of protections that has been agreed internationally by others. So
we can learn from the experience. We can learn from the experience of other countries.
Exactly, and it's both. I mean, there's things we can teach of what's done locally, because there's fantastic work done at the local level in the United States, but also learning a lot from what other countries do, which are, really way in some areas, way ahead. And Nichelle, please go ahead.
Yeah, as with last year, I'm sure if you were on our last launch from the previous year, my message is the same. Continue to share your stories with us, with the media, however you can get them out there to highlight and expose tobacco industry interference, and continue to share this report, share the global report, and utilize the tools available to you, such as the lobbyist tracker that we launched, so that you can strengthen your local, state and local advocacy efforts. And thank you all for joining.
Thank you so much. Once again, I want to thank the panelists. Thank you, LaTrisha, for joining us, Nichelle and Laura. And then I want to, if you're interested in this topic, on the 22nd, at 11 a.m. DC time, we will have global examples from other countries, given that this is interfering just really taking place all over the world. There will be a webinar on the topic And there's also one tomorrow, which is in preparation for the COP, for the treaty on tobacco, which is starting the following week. So you can join us tomorrow. There's one, you can find some more information on our website. And on the 22nd, which will provide examples of industry interference from Spain, and also best practices and recommendations from other countries. So thank you again so much for joining us today, and a wonderful rest of the day, depending on where you are. Thank you so much. Bye-bye.